Hi, this is Brandon with Chiro. Today I had a patient come in and she's having some numbness and tingling extending into her fingers. It's been going on for a long period of time, and she gets it a lot when she's working at a desk, especially when she's doing a lot of typing. And she described her symptoms as numbness and tingling in this area. It's fairly constant throughout the day. However, when she's able to lie down, she has some increase in movement, the pain in the neck and shoulders, and also the paresthesia into her fingers go away. And one of the clinical pearls as far as evaluating and treating thoracic outlet syndrome is that 90% of people have paresthesia in those fourth and fifth digits. So it's a big thing to look for when you start to get those symptoms. The way we can further delineate that as far as having a thoracic outlet syndrome is by doing Roux test and brachial compression test. But if we want to get down to what we want to treat, we need to look at the tissue sources. So as far as thoracic outlet syndrome and treating, as far as the scalings, the pec minor and costoclavicular region, we need to look at three specific tests. So the first one being Adson's test. So if we have scaling involvement, we're monitoring the radial pulse, having the patient look towards the ipsilateral side, looking for any kind of change in pulse or change in symptoms, and then also modified Adson's going to the opposite side. If we want to look at the pec minor, we're going to do right hyperabduction, where the patient's bringing the arm all the way back into full extension, monitor radial pulse. And then the last one being the costoclavicular maneuver, where the patient's going to bring the head down, pinch the shoulder blades together, and then monitor the radial pulse. This is a great way to see if there's a change side to side. If you want to also monitor the opposite side for blood flow and also for neurologic compromise. This is not often in isolation. This is a double crush injury. It's kind of like carpal tunnel syndrome, but with this, look for cubital tunnel syndrome, where the ulnar nerve goes past the elbow, and often you can find some symptoms there also. Check out Chiro as far as the documentation, as far as the evaluation and management, and looking at nerve flossing, how to perform those techniques, and how to get these patients well.